Hi, my name is John Flett. I'm a pediatrician who spends my time helping parents, family, teachers who deal with children that think and learn just a little differently. How about ADHD medication? Perhaps you are a parent who is considering treatment for your child. You've heard a lot of urban legends. You've heard lots of worries like my child's going to become a zombie. They're going to lose their personality. It's going to stunt their growth. They're going to start off by taking stimulant medication and they're going to land up being addicted to medication, taking crack, cocaine, crystal meth. You must have heard of a couple of those things. Or perhaps you're an existing set of parents or somebody who is treating their child for ADHD with medication, and you're concerned about what it's doing to your child. A lot of parents feel guilty. You know, it doesn't seem right to be able to medicate your child for something that you can't actually see, a problem that you have to rely on doctors and professionals who tell you there's a problem. You know, there's a problem at school. Maybe you don't see it at home. Maybe you're a teacher who's concerned about a child being on medication. And treating a child with medication really needs an experienced physician. It's no good just getting a generalist just to write a script. You may as well get just anybody to write a script. It needs somebody who can get information from the teacher on rating scales, talk to you, spend some time, not just 5-10 minutes and out the door. You know, your child deserves an accurate professional approach to treating ADHD. Now, the medication itself, you know, you might have heard that it causes motor tics Tourette syndrome. You know, the research that is being done says that it doesn't actually cause Tourette syndrome. It can maybe unmask it. It can maybe make something worse. So it's a matter of being very careful. And I often find out to ask questions about nervous tics, motor tics, Tourette syndrome, cardiac problems. It's very important if your child has a cardiac problem that they are properly assessed to make sure that we don't exacerbate if your child's had cardiac surgery, has blood pressure problems. Those are things to take very seriously. And also, if your child is very sensitive to stimulants, certain medications like cough and cold medicine, like the pseudoephedrines, stimulants, coffee, you know, if your child's sensitive to things like that, there's a possibility that if your child's sensitive to stimulant medications like Ritalin or methylphenidate or Concerta, that they're going to be sensitive. There are genetic tests to determine whether your child might be overly sensitive, be what we call a fast metabolizer to certain medicines. But those are not really that accurate. The most important thing is having a doctor who can determine, and that first test dose, that first trial of medicine, make sure that you give the doctor the correct feedback. Make sure that you observe your child. Have they started to become a bit withdrawn? Talk to the teacher, because a lot of the short-acting medicines only work at school. And by the time they get home, you don't actually see it. So that's why I feel it's important to give the medication at the weekends, so that you as a parent can find out, you know, for yourself what exactly the problem is. You need to watch, you know, when the medicine goes up in the morning, does your child become withdrawn? Do they lose their appetite? When the medicine comes down, do they have those rebound symptoms, become irritable, frustrated, almost like a champagne bottle that's been shaken and the cork being taken off? And all those symptoms and built-up frustrations erupt in the afternoon, so-called the sort of rebound symptoms. And that's what it's needed, is to carefully observe. Does your child have problems with becoming a little bit more anxious, a bit more kind of irritable? It may mean that your child is a very sensitive person to the medication. They are very sensitive. Some children actually, you know, you can give them a dose and you go up on the dose and it doesn't seem to have any effect. They are so-called fast metabolism kind of metabolizes, and they might really what we call, they just burn it up. They need higher doses. It can affect the sleep. It can certainly make some children a little bit more withdrawn. Sometimes they might be on too high a dose. But all these medications, the stimulants in particular, if you have a doctor who understands it and observes and kind of goes carefully, it's a very safe option. There are also the non-stimulants, if your child is very sensitive. Only the other day I saw a child who has a very rare side effect. They have an allergy to Ritalin or methylphenidate, and they get red eyes, almost like a conjunctivitis, almost like kind of pink eye all the time. So one of the things that also I think, parents worry, does my child need to stay on this medicine? When will they come off the medicine? And, I don't really want to give the medication because, I don't want to give it for me. I don't want to give it so I have an easy time. That's something I often hear parents complain about. What I would say to you about the medicine is that don't think about the medication as a medication trying to drug your child so that everybody has an easier time. Just think of how many times you've got to give instruction to your child. James, don't do that. James, stop. You can't do that. You can't put your feet on the couch. You can't do that. You can't go there now. By the age of 10, a lot of children with ADHD have 10,000 more criticisms than the other children. So by medicating, you're allowing your child to become more self-aware, to be able to listen, to have more emotional control, more impulse control. And long as we monitor weight, height, and I often ask children, how does the medication make you feel? So it's important to communicate, particularly when your child's a bit older. Talk to the teacher. The medication for ADHD is incredibly safe. It's important to give all the time. Think about if your child had epilepsy, had fits. You wouldn't stop the medicine at the weekend and use it during the school week. And ADHD medicine is no different. Just because you can't see what's happening. When you stop the medicine, the brain stops. It needs that, it's neuroprotective. The more consistently the medication is given, the sooner your child's going to come off that medicine. And to patients of mine, if you have any concerns about the medication, drop me an email, put your thoughts on the group. It's important to discuss what your concerns are. A lot of people are worried that it's going to affect the heart. The FDA in the United States did a major research program and looked at 60 million years of treatment in children, 60 million life years, and found that there was no correlation between ADHD medicine and cardiac problems and sudden death. So long as it's properly prescribed, we react in case children are sensitive to those stimulant medications, it is a safe treatment.